Okay, so like Dr. Stern said, it's really nice to follow that. But I am Andrew Nguyen. I am your Research and Admin Chief for 2016-2017. I am very excited because today I am sharing with you our first research update for the academic year. And this is something I always enjoyed my prior 3 years because I think it's something that's really inspiring for you guys. I know you guys are working clinically day after day, but it kind of gives you a look at what we can do outside of the clinical arena. And I also feel very honored to be able to do this and present because I get to highlight a lot of the amazing things coming out of our department and also acknowledge the accomplishments of our peers. So before we move on to those acknowledgements, the research team, which is really unchanged aside from me, but Drs. Sinner, Tatachi, Palladino, and Martindale, they are all there as resources for you, whether you are a resident or an attending looking into a research inquiry. With that said, our research team is really inclusive of so many attendings in our department, and I'll touch on that now with a little bit of housekeeping in regards to the elective. So as residents, a part of this program, we have a scholarly activity that we have to complete. That's a requirement. I pressed on it. So that's a requirement, right? So we have designated research time during our second years and our third years, 2 weeks in each year. 2 weeks in each year. But for the PGY ones, if you come across an opportunity, totally jump on it. Opportunities, come and go. But for the PGY 2s and PGY 3s, expect to hear from me, receive an email from me 2 months prior to your elective. And at that time, we can start planning. And I encourage you to reach out to attendings you may be interested in working with. If you have an interest possibly in health policy, maybe you want to reach out to Dr. Foley. If you've been to Lutheran and you've already made that connection, maybe you want to reach out to Dr. Gavin, who recently published, I don't know if you guys noticed, published in Annals of Emergency Medicine in June on observation units. So you can reach out to him, hey, I read your article, observation units are a passion of mine, and that's where the conversation starts, okay? But if you're interested in international medicine, if you're interested in sports medicine, ultrasound, palliative, we really have attendings here to really meet those needs for you. And a little bit of motivation for you, I guess you could say. So this photo was taken, this photo was taken at SAM, which was held in May in New Orleans this past year. And I had the opportunity to go with the other chiefs, and it was such a great opportunity, really. So inspiring, getting to see leaders in the field and meet leaders in the field, and also run into so many of our alumni who are doing great things in academic emergency medicine. And it was also great to be able to go and support those individuals from our department who were presenting. And so this really could be you next year. And if everything works out, hopefully I'll be there next year. And so that could be us. That could be us. So I think it's in Orlando, Florida this year. So as far as SAM is concerned, we did have several presenters, which was really exciting. And they went on to publish in Academic Emergency Medicine. The first is Liz Abram, who was a recent graduate of our program. And she worked with Adam Nordstrom, also a recent graduate, Dr. Shibata, who is a PGY 5, Dr. Sinner Palladino, on diagnosing urolithiasis and nephrolithiasis in the ED using ultrasound and urine analysis. And Dr. Sinner actually was a part of that session, which was really great. How many sessions did you run? Was there 5 or 6 sessions? 7 or a dozen sessions? A lot of sessions. But essentially, it was great work, great presentation. Out of pediatrics, we do have a lot of work, so if you're interested in pediatrics, that's an opportunity for you as well. Dr. Agaritzis, Peacock, Lagome, Bober, and Sinnert on applying lean to improve throughput metrics in a pediatric emergency department. Dr. Bober, who is no longer with us, unfortunately, having moved on. Dr. Bober, who was a great fellow here, did a lot of work in pediatric ambulance use in the United States, the role of health insurance. And then Dr. Broden, who's actually in attendance at PGY 4 EMIM, working with one of our ID fellows, Dr. Rose and Dr. Sinnert, on the COMPEL study, which is a comparison of antibiograms for ED-based patients and admitted patients. So they all presented. And Dr. Sinner also presented his work on Academia. And I still get that request from attendings. I love hearing that, to call in these patients, these angioedema patients. So that study is no longer running. The results were a little disappointing. Maybe Dr. Sinner can touch on that in the future. But he was able to present that, which was really nice to be in attendance and to see that. And then Dr. Subramanian, who is also from our pediatrics department, one of our Crown Fellows, on operating characteristics of point-of-care ultrasound to identify abscesses in BP. And then in regards to publications, really Dr. Martindale doing the most. So for the PGY1s who haven't met Dr. Martindale, she's a beloved faculty member here, and she recently planned a wedding and is on her honeymoon, and she's going to school and she's working clinically, and yet she's still publishing. It's pretty amazing. So she has and does a lot of work in CHF management, and she released with these other authors a consensus statement from the Society of Academic Emergency Medicine and the Heart Failure Society. She also published this article in the American Journal of Emergency Medicine, Resolution of Sonographic B-lines as a measure of pulmonary decongestion in acute heart failure. So essentially how you're going to follow your heart failure patients once they're admitted. Again, out of pediatrics, Dr. Agarixas, Chow, and Sinner, predicting flow in the pediatric emergency department. Are holidays later? That's a good question. Are holidays later? And Dr. Chow and Dr. Sinner with a recently accepted manuscript. Is nebulized hypertonic saline effective for acute bronchiolitis? Maybe we can have Dr. Chow touch on that in the future. So again, PGY1s who are not familiar, here at Kings County, we have the opportunity as residents to author EMEDICINE chapters and to revise EMEDICINE chapters, and it really comes down to our attendings who are really well connected. So there are 5 chapters I want to share with you. Drs. Sinner, Reagan, and Jane, ventilator management. Drs. Little and Sinner, asthma and pregnancy. And Drs. Quinn and Sinner, metabolic acidosis in the emergency department. And then Dr. Sinner and 2 collaborators, hypernatremia in the emergency department and TNJ syndrome in the emergency department. So lastly, just the studies that we are actively enrolling. So all of our studies we can do because you guys are enrolling our patients, and we're very appreciative of that. So in all of my monthly updates, my research updates that I send to you with email, I always include these phone numbers. You can always have your Gmail up as a reference, but we do ask that you help us to enroll these patients. So as you know, on both sides of the street, we're always enrolling our CHF patients. You do not have to wait for a BNP, really clinical diagnoses will apply here, and you can just call a phone number. Also, acute pulmonary edema, those patients we would love to hear from you. We're doing a study for patients with presumed gastroenteritis, or for what you're treating gastroenteritis, and this is really looking into a short and long-term formulation of Zofran, a combined formulation, and in these patients, you're not going to be having, you would not have given them IV fluids or IV antiemetics, all oral, okay?
Is that for only patients who are admitting, or anybody that you see?
No, I mean, hopefully, anyone that you see, I imagine that the patients you wouldn't admit it, yeah. And then at UHB, also any pulmonary embolisms, we would love to hear from you. Our RESET trial, which looks, and is inclusive of any sickle cell patient, 6 and older, admitted for vaso-occlusive crisis. And this is really distinct from the frequent flyers we see at UHB who are often coming in for public pain secondary to AVN, more so than vaso-occlusive crisis. And then if you are reversing a patient on a novel oral anticoagulant, please also call this number. And then the second number is for all of our neurology studies, and we work very closely with neurology. This is the phone number for any stroke or any TIA less than 12 hours onset of symptoms. So Dr. Law will be very appreciative of all of your enrollments there. And that's it. So please call, continue to enroll. We're very appreciative of your involvement there. And if you have any questions, please feel free to email us.